Hello everyone. So we start to the new topic, topography, anterior region of the arm. Now in this anterior region of arm is also known as anterior brachial region. So first we will know about the landmarks. What are the landmarks of the anterior region of the arm? First is the deltoid muscle here. Okay. Second is pectoralis major muscle. This one is the pectoralis major muscle. Latissimus dorsi muscle. Latissimus dorsi muscle. Bicep brachii. Bicep brachii muscle. Tricep brachii muscle. Okay. Medial and lateral epicondyle of the humerus. Now, medial and lateral, see, medial epicondyle and lateral epicondyle of the humerus. Greater tubercle of the humerus. And sulci bicipitalis lateralis medialis. Okay. Which is this? Fossa. Now, we learned about the landmarks. What are those? Deltoid muscle, pectoralis major muscle, latissimus dorsi muscle, tricep brachii, bicep brachii muscle, lateral epicondyle, medial epicondyle, greater tubercle, and sulci bicipitalis lateralis medialis. Now what are the borders? Now borders superiorly, when we draw horizontal line from the pectoralis major and latissimus dorsi muscle. If we draw a line from this pectoralis major and latissimus dorsi muscle or horizontal line, it would be the superior border. Inferiorly, if we take imaginary line 2 fingers above the lateral epicondyle and the medial epicondyle. Okay. If we take 2 centimeters above, that is inferior border. Okay. Now medial and laterally, lateral. Medially, if we draw vertical line, okay, from the medial epicondyle and vertical line from the lateral epicondyle. This is the medial and lateral border. What is the superior? Pectoralis major and latissimus dorsi muscle, we draw horizontal line. Inferiorly, 2 centimeters above from the medial and lateral epicondyle. Medially, a vertical line from the medial epicondyle. Laterally, a vertical line from the lateral epicondyle. These are the borders. Now, what are the layers? Layers are, first is the skin. Now, in skin, the lateral thickness is greater than the medial thickness. Okay. Second is the innervation. What are the innervation? Medial cutaneous nerve of the arm, lateral cutaneous nerve of the arm, superior medial cutaneous nerve of the arm, inferior medial cutaneous nerve of the arm. Okay, sorry. Medial cutaneous nerve of the arm, lateral cutaneous nerve of the arm, superior and inferior lateral cutaneous nerve of the arm. These are the innervation of the skin. In the subcutaneous tissue contains cephalic and basilic vein with cubital lymph nodes. Superficial fascia, it forms a covering for the superficial vein and cutaneous nerve. Now in deep fascia, which is also called as brachial fascia. Now in deep fascia there are 2 septa, okay, which are connected to the humerus, namely lateral intermuscular septum and medial intermuscular septum. Okay. There is a transverse septum which separates bicep brachii muscle. See, this is the bicep brachii muscle which is divided by transverse septum by which muscle? Brachialis muscle. Between this brachialis muscle and bicep brachii muscle there is a transverse septum which is here. Okay. There is a medial septum which is pierced, okay, by ulnar nerve. See, this medial septum, there is ulnar nerve, okay, superior ulnar collateral artery, okay, and to the posterior surface of the medial epicondyle. In the lateral septum, it is pierced by radial nerve. Fine, this is the radial nerve in the lateral septum. Okay. An anterior descending branch of profunda brachii artery, which is to the anterior surface of the lateral epicondyle. Medial intermuscular septum, it is to the posterior surface of the medial epicondyle. And this anterior descending branch of profunda brachii artery, it is to the anterior surface of the lateral epicondyle. Fine. Now what are the muscles? The muscle is coracobrachialis muscle. Now coracobrachialis muscle, its origin is coracoid process of the scapula. Insertion is medial surface of the humerus. And action is flexion and adducts the arm. Second is bicep brachii muscle. Now bicep brachii muscle, its origin is supraglenoid tubercle. First is the long head of the bicep brachii, which is supraglenoid tubercle. Next is the coracoid process, which is the short head, and insertion is radial tuberosity. Fine. Next is brachialis muscle. Brachialis muscle origin is anterior surface of the distal of the humerus, and insertion is coronoid process of the ulna and ulnar tuberosity. This was about the anterior region of the arm. Now, next is the posterior region of the arm, which is also called as posterior brachial artery. Posterior brachial region. Now, what are the landmarks? Landmarks are same: deltoid muscle, pectoralis major muscle, latissimus dorsi muscle, bicep and tricep muscle. Fine. Medial and lateral epicondyle, greater tubercle of the humerus, sulci deltoid pectoralis, where the pectoralis major goes, and deltoid tuberosity is there, deltoid of the humerus, and sulci bicipitalis lateralis medialis. Now what are the borders? Border, same again. Superiorly, we draw a horizontal line from which muscle? Pectoralis major and latissimus dorsi muscle. Inferiorly, again 2 centimeters above, draw a line. And medial and lateral, vertical line from the medial epicondyle and lateral epicondyle. Same as anterior region of the arm. Now layers are skin. It is very well thick and connected with subcutaneous tissue. Now in subcutaneous tissue, there are nerve connection. Superior lateral cutaneous nerve of the arm, inferior lateral cutaneous nerve of the arm. This was there in the anterior region also. And posterior cutaneous nerve of the forearm. Fine. Now there is a superficial fascia. That's it. There is nothing, any content into it. Deep fascia, it is forming a covering of tricep brachii muscle and its tendon. Fine. Now muscle behind in the posterior arm is tricep brachii muscle, and there is a humeromuscular canal, which is called as canalis spiralis. In this canalis spiralis, there is radial nerve, deep artery of the arm and vein passing through this canal. Okay. Now we will learn about few triangles which are there in the arm region. Forearm. Superior trilateral foramen, inferior trilateral foramen, and quadrilateral foramen. Now where are these foramen situated? Okay. Now first is the superior trilateral foramen. Okay. Here is this superior trilateral foramen. Now what are the borders? Borders are medially there is teres minor muscle. See here. See, just keep remember there are muscles. Which are the muscles? Teres major, teres minor, long head of tricep, and surgical neck of the humerus. These 4 contents make this 3 foramen. First is superior trilateral foramen. Superior, it's up. Trilateral means 3 side, and foramen means there is a kind of opening. Medially, there is teres minor muscle. Laterally, there is long head of tricep brachii muscle. Okay, and inferiorly, teres major muscle. Fine. Inferior trilateral foramen medially. See, inferior trilateral foramen. Medially, there is long head of tricep muscle. Laterally, there is medial margin of the humerus. And superiorly, there is teres major muscle. Okay. Now, quadrilateral foramen. This, four-sided. Medially, what is there? There is a lateral margin of the long head of tricep brachii muscle. Okay. See, lateral margin of long head of tricep brachii muscle. Laterally, surgical neck of the humerus. Laterally, surgical neck of the humerus. Superiorly, teres minor muscle and subscapularis muscle. See, here teres minor muscle, it comes from posterior aspect, and subscapularis muscle, it comes from anterior aspect. Okay, and inferiorly there is teres major muscle. Now, what are the contents of this three foramen? First one, superior trilateral foramen. The content is circumflex scapular artery. Circumflex scapular artery. In inferior trilateral foramen, the content is radial nerve, deep artery of the arm. Okay, radial nerve and deep artery of the arm. And quadrilateral foramen, the content is axillary nerve and posterior circumflex humeral artery. In superior trilateral foramen, there is circumflex scapular artery. Fine. In quadrilateral foramen, axillary nerve and posterior circumflex humeral artery. And in inferior trilateral foramen, there is radial nerve and deep artery of the arm. Now we move on to canals of the radial nerve. Now, it is also called as spiral canal, canalis spiralis. It is also called as humeromuscular canal, which is canalis humeromuscularis and canalis nervi radialis. Now, what is topography of this? It is bounded by humerus of tricep brachii muscle, but long head and both long head and short head. And it contains radial nerve, deep artery of the arm and its vein. Now, we will learn how the phlegm is spread. Phlegm is a spurative inflammation of fatty tissue which passes along the nerves and vessels. If the phlegm is in cubital fossa, fine, then it may travel to wrist joint or up to the axillary region. From the axillary region, it may pass to scapular region, which passes through along the humeromuscular canal to posterior compartment of the arm, and through the posterior compartment of the arm, then it passes to the subclavian region and thoracic cavity. Now, if the phlegm is in axillary artery, it passes to subpectoral space and to the anterior mediastinum. Now, how do we do the incision of the phlegm? In the anterior compartment of the hand, there are two incisions made. One, it is along the lateral and another medial border. Of what muscle? Bicep brachii muscle. Okay. In the posterior compartment, the borders of the tricep brachii muscle. Fine. In the axillary region, posterior to projected line of the axillary artery. In the deltoid region, we may make it to the anterior border of the deltoid muscle. Keep remember, we cannot make along the posterior border due to axillary nerve. If we cut this axillary nerve, there may be paralysis of the deltoid muscle. Now, what are the projection line of the vessels? Fine. Where these muscles are exactly situated. Now, axillary artery. Axillary artery is 1.5 centimeter along the anterior margin of the axillary fossa. Brachial artery is in the axillary fossa, where it is a midpoint between medial epicondyle of the humerus and tendon of the bicep brachii muscle. Radial artery, it is medial margin of the tendon of the bicep brachii muscle or midpoint of the cubital fossa, which is 0.5 centimeter lateral from the styloid process of the radius. And ulnar artery is medial epicondyle of the humerus to lateral margin of the pisiform bone. Now we would make access to the vessels. Fine. What is the access to the axillary artery? It is 8 to 10 centimeter along the medial margin of the coracobrachialis muscle, where there is an axillary fossa. Okay. Now brachial artery, it is medial 1/3 of the arm, 6 to 8 centimeter in length, 2 centimeter lateral of the medial margin of the bicep brachii muscle. Next on the cubital fossa, 6 to 8 centimeter and 2 centimeter from the medial epicondyle of the humerus to lateral margin of the forearm. Now radial artery, there is superior 1/3 of the forearm and lower 1/3 of the forearm. In the superior 1/3 of the forearm, medial margin of the brachialis muscle, and in the lower 1/3 of the forearm, 6 to 8 centimeter incision along the projection of the line. Now ulnar artery, superior 1/3 and lower 1/3. Incision of 8 to 10 centimeter along the projection line in the superior 1/3 and incision along the 6 to 8 centimeter along the projection line. Fine. Now we would see the access to the nerve. Access to the nerve, first one is the brachial plexus. Okay. If we make an incision on the superior 1/3 along the posterior margin of the sternocleidomastoid muscle downwards obliquely to the midpoint of the clavicle and continue along the anterior surface of the clavicle laterally till the sulcus deltoidopectoralis. Radial nerve, there is two parts, middle 1/3 of the arm and cubital region. Here we make an incision of 10 to 12 centimeter from the midpoint of the posterior margin of the deltoid muscle to lateral margin of the bicep brachii muscle. In the cubital region, we make an incision of 10 to 12 centimeter from the lateral margin of the bicep brachii muscle to medial margin of the brachioradialis muscle. In axillary nerve, we make an incision from midpoint of the spine of the scapula and continue along the posterior margin of the deltoid muscle. Median nerve. Median nerve is divided into three regions. Middle 1/3, superior 1/3, okay, and lower 1/3. Now middle 1/3 of the arm, superior 1/3 of the forearm and lower 1/3 of the forearm. Okay. Middle 1/3 of the arm, 8 to 10 centimeter medial margin of the bicep brachii muscle. Superior, we make an incision 8 to 10 centimeter from midpoint of the cubital fossa on the projection line. And lower 1/3 of the forearm, we make an incision along the midline of the forearm where medial margin of the flexor carpi radialis tendon is there. Now ulnar nerve. Ulnar nerve, lower 1/3 of the arm, we make an incision 8 to 10 centimeter middle point of the sulcus bicipitalis medialis to medial epicondyle of the humerus. On forearm, where there is a medial epicondyle of the humerus, we make an incision up to lateral margin of the pisiform bone. On hand, we make an incision 4 centimeter above and 0.5 centimeter lateral to the pisiform bone and passes to the hypothenar margin in arc shape. Okay, see here we have seen this ulnar nerve. Okay. Now we will move on to the topography of the elbow. Okay. What are the landmarks? First, olecranon of the ulna. Okay. Brachioradialis muscle. Brachioradialis muscle. Tendon of bicep brachii muscle. Medial and lateral epicondyle. Medial and lateral epicondyle. Sulcus cubitalis anterior and posterior lateralis to medialis. Whenever we apply a tourniquet means what? We tie it here. Okay. The cephalic, basilic and medial cubital veins are clearly visible. Okay, just remember the cephalic, basilic and medial cubital veins are clearly visible. Now, what are the borders? Border is 4 cm from the level where connect medial and lateral epicondyle of the humerus. Horizontal line. We need to draw a horizontal line 4 cm up, a horizontal line from the medial and lateral epicondyle of the humerus, and 2 vertical line from the medial and lateral epicondyle, which divides this humerus elbow region into anterior cubital region and posterior region. Now, topography of this anterior cubital region and posterior region of the elbow region. Okay. Anterior cubital region, there are layers. First is skin, which is thin, movable, non-pigmented, contains sweat gland, sebaceous gland and hair. Nerve is lateral and medial cutaneous nerve of arm and forearm. There is subcutaneous tissue in which lymphatic vessels with nodes and venous network are present. Cephalic, basilic and median cubital vessels are present. Okay. And this cephalic forms N shape. Like it looks like alphabet N. Basilic is superior cubital node near this vein and near the medial epicondyle of the humerus. Now, superficial fascia. It connects with the fascia of the arm and forearm. Aponeurosis of the bicep brachii muscle and connects with the deep fascia. Now, deep fascia of the bicep brachii and brachialis muscle forms lateral and medial intermuscular septa. Keep remember, fascia of bicep brachii and brachialis muscle forms lateral and medial intermuscular septa fixed to medial and lateral epicondyle and covers muscles of the arm and forearm. Now, inferior to radial tuberosity, there is tendon of the bicep brachii muscle which forms intermuscular septa, content to form anterior radial intermuscular septa of the forearm. Now, there are 3 groups of muscles. Laterally, brachioradialis muscle, supinator muscle. Median, bicep brachii muscle, superiorly, brachioradialis muscle, deep. Medially, first layer, pronator teres, flexor carpi radialis, palmaris longus, flexor carpi ulnaris muscle. And second layer, flexor digitorum superficialis muscle. Fine. Now we would move on to the neurovascular bundles. There are 2 neurovascular bundles found between the groups of muscle and septa. First is the brachial artery. Okay. It is divided into lateral and medial. See, lateral and medial. In the lateral bundle, there is radial nerve and radial collateral artery. Okay. And medial bundle, it is brachial artery and median nerve. Now we move on to the brachial artery. Brachial artery, medial margin of the bicep brachii muscle, and it divides into radial and ulnar artery under the bicipital aponeurosis. Okay. Radial artery, it passes through bicep brachii muscle tendon situated between the pronator teres and brachioradialis muscle. Now, next is ulnar artery. Ulnar artery, it exists inferior to pronator muscle and which is in the upper part, and it is later located between superficial and deep flexor of the fingers, which where are flexor digitorum, superficialis muscle and flexor digitorum profundus muscle. Next is median nerve. It lies 0.5 to 1 centimeter from the medial margin of the bicep brachii muscle near to the ulnar artery in the upper part, and it perforates pronator teres muscle. Radial nerve, which is situated between brachioradialis muscle and brachialis muscle, and later it goes down and divided into superior and deep branches of radial nerve at the level of lateral epicondyle of the humerus. Now this superficial branch which innervates brachioradialis muscle and pronator teres muscle, and deep it lies laterally and passes through supinator canal between the superficial and deep layer of supinator muscle. Now next is topography of the posterior cubital region. Landmarks are olecranon fossa, sulci cubitalis posterior lateralis to medial, where ulnar nerve is present and head of the radius is palpated in the middle part. Now next is ulnar layers. First is skin, which is thick and movable, forms skin fold. Next is subcutaneous tissue. Subcutaneous tissue, it contains superficial artery which has a branch, medial collateral artery, radial collateral artery, recurrent interosseous artery, posterior and medial cutaneous nerve of the arm and forearm. Now there are bursa of elbow joint, which is superior to olecranon of ulna. Next is superficial fascia, which is thin layered without fixation. Deep fascia formed by aponeurosis fixed to tendon of tricep brachii muscle, medial and lateral epicondyle of the humerus, and olecranon of ulna. Now there are various muscles. Superiorly there is tricep brachii and anconeus muscle. Laterally there are extensor muscles of the wrist joint. Which are those? Extensor carpi radialis longus, extensor carpi radialis brevis, extensor carpi ulnaris muscle. An extensor muscle of digits, extensor muscle digitorium, extensor digiti minimi, and deep there is supinator muscle, and medially there is flexor digitorium profundus, flexor carpi ulnaris muscle. Now we move on to the next topic, topography of forearm. Okay, what are the landmarks? First is the brachioradialis muscle, sulci radialis and ulnaris, tendon of the flexor carpi radialis and palmaris longus muscle. And fourth is styloid process of ulna and radius. Now what are the borders? Upper, if we draw horizontal line drawn 4 cm distal to the level of the wrist joint, and lower transverse line drawn 2 cm proximal to the styloid process of the radius. If we draw two vertical line according to the epicondyle and styloid process which divides forearm into anterior and posterior region. Now according to this there are two regions, anterior region of the forearm and posterior region of the forearm. We would study topography of this region. Layers, skin, it is thin, contains sweat and sebaceous glands, medial and lateral cutaneous nerve is present. In the subcutaneous tissue, it contains cephalic vein, basalic vein and intermedial antebrachial vein. and lateral and medial cutaneous nerve of the forearm is present. Now there is superficial fascia. Superficial fascia, it is not attached to the bone and covers all structures in the subcutaneous tissue. Deep fascia, it forms covering of the muscle, vein, nerves and bones. Thick proximal and thinner distal region. Okay, there are two septa of the radius and divides forearm into three sets of muscle. Okay, what are these three sets? Lateral, posterior, anterior. Laterally, there is brachioradialis muscle, extensor carpi radialis longus, extensor carpi radialis brevis. Posteriorly, there is extensor digitorium, extensor digiti minimi, extensor carpi ulnaris, anconeus and supinator muscle. And anteriorly, there is superficial muscle which are pronator teres, flexor carpi digitorium superficialis, flexor carpi digitorium, flexor carpi radialis, flexor carpi digitorium superficialis, palmaris longus and flexor carpi ulnaris. These are superficial. There are also deep. Deep muscles are flexor digitorium profundus and flexor pollicis longus muscle. Fine. Now we would study borders of the fascia. Now anteriorly it is fixed to the deep fascia. Posteriorly interosseous membrane ulnar of ulna and radius. Medially posterior margin of ulna and laterally sulcus radialis is present. Now there is a Pyrgov space. What is it? Situated in the lower half of the deep fascia. Okay, anteriorly the fascia of flexor digitorium and flexor pollicis longus muscle is there, and posteriorly fascia of pronator quadratus muscle. Muscles are medial margin of the deep fascia bounded to posterior margin of the muscle, margin of the ulna, and divides the muscles into four layers. Now first layer is where pronator teres, flexor carpi radialis, palmaris longus, flexor carpi ulnaris and brachioradialis is present. We can see here. Okay. First is pronator teres muscle. Second is flexor carpi radialis muscle. Next is palmaris longus muscle. Next is flexor carpi ulnaris muscle. And up it is brachioradialis. You can keep remember. Okay. See, it is very easy. Brachioradialis, it is here. It's a order. It's a set of four muscles. Pronator teres, flexor carpi radialis, palmaris longus, flexor carpi ulnaris. First is pronator teres. Then flexor carpi radialis. Last is flexor carpi ulnaris. And in between this, there is palmaris longus. Just remember like this. First layer. Second layer, only one muscle. Flexor digitorium superficialis muscle. Third layer, there are two muscles. Flexor digitorium profundus, flexor pollicis longus. Flexor digitorium profundus and flexor pollicis longus. Flexor means it does flexion. Digitorium means it moves to the digits. Okay. And profundus, which is deep. It is a third layer, right? So it is deep. And how does flexor pollicis longus means? Flexor means it does flexion. Pollicis means thumb. And longus means it is in length. Okay. Fourth layer, there is one muscle, pronator quadratus muscle. See, it is here, pronator quadratus muscle. Don't get confusion in pronator teres and pronator quadratus. Pronator teres is in the first layer, pronator quadratus is the last layer. Fine. Next is neurovascular bundles. Neurovascular bundles, there are again three parts. Now neurovascular bundles, laterally there is a radial artery and vein, superficial branch of the radial nerve. Where it is located? Sulcus radialis. In the upper 1/3 of the forearm, it is bounded to the brachioradialis muscle, which is laterally, and pronator teres muscle medially. Radial artery, it passes with the middle part of the elbow joint to the styloid process of the radius and enters anatomical snuff box. Next is the medial part. Medially, there is ulnar artery, ulnar nerve, and posterior interosseous artery. Ulnar artery, it is near the tendon of bicep brachii muscle, in the middle one third under pronator teres muscle, flexor digitorum superficialis muscle, and sulcus ulnaris. In the lower one third, medial margin of the styloid process of the ulna and reaches pisiform bone. In the median, there are anterior and posterior division. In anterior division, it is median nerve, and posterior interosseous artery and nerve. You can see here all this nerves and arteries. Okay. Now we move on to the posterior region of the forearm. In the posterior region of the forearm, the layers is skin, which is thick. Nerve is median, lateral, posterior cutaneous nerve of the forearm. Subcutaneous tissue, cephalic and basilic vein is there. Superficial fascia, which is a weak layer. Deep layer, it is thick, forms aponeurosis in the upper half of the forearm and extends downwards, form extensor reticulum and dorsal carpal tunnel. Now it forms a cellular space for radial nerve, posterior interosseous artery, and posterior interosseous vein and nerve. This radial nerve, it passes from a canal, which is canalis supinatoris. Okay. Now muscles are superficial muscle, which is extensor carpi radialis longus, extensor carpi radialis longus and brevis. This is longus, this is brevis. Next is extensor digitorium, which is extensor digitorium, which moves to the digits. Extensor digiti minimi, extensor digiti minimi, extensor carpi ulnaris, extensor carpi ulnaris, and anconeus. It is a small muscle. Deep muscles are supinator muscle, okay, abductor pollicis longus, extensor pollicis brevis muscle, extensor indicis muscle, extensor pollicis longus muscle. Now, topography of the hand region. In the topography of the hand region, landmark is styloid process of the ulnar and radius, skin fold of the wrist joint, metacarpal bone, phalanges of the fingers. Border is 2 cm above the styloid process of ulna and vertical line drawn along the ulna radius, which divides into palmar and dorsal region. Now, palmar region, layer is skin, which is thick, stratum corneum, sweat gland is present, and sebaceous gland. Nerve is a rum, radial ulnar median nerve. Subcutaneous tissue, superficial palmar branch of radial artery is present. There is superficial fascia, but their contents are not there. Deep fascia, in deep fascia, it stretches from palmaris longus tendon to ligamentum carpi volare, and it forms palmar aponeurosis, flexor reticulum, synovial sheath of the hand and fingers. Now we would discuss all three. First is flexor reticulum. It is the strongest and thickest fascia. Now, this flexor reticulum, it is formed by carpi ulnaris, okay, carpi ulnaris, carpi radialis, flexor reticulum, it converts sulcus carpi into canalis carpi. Now, this flexor reticulum forms canalis carpi radialis and canalis carpi ulnaris. Now, next is the synovial sheath. Synovial sheath, it is situated laterally, okay, and first is synovial sheath of the thumb, which is present laterally. Tendon of the flexor pollicis longus. Uh, now this now superiorly the sheath protrudes 1 to 2 centimeter proximal to the flexor reticulum, okay, and inferiorly it extends to the base of the distal phalange of the thumb. Now synovial sheath of the index, middle and ring finger. These three finger has common sheath on the palmar surface. See, common sheath, and it extends um, different sheath on the metacarpal region. This sheath stretches from the line of the metacarpophalangeal joints to the base of the distal phalange. Synovial sheath of the little finger. It covers flexor digitorum superficialis and profundus muscle. It covers flexor digitorum superficialis and flexor digitorum profundus muscle. Its superiorly sheath protrudes 1 to 2 centimeter proximal to the flexor reticulum, and inferiorly it extends on the flexor until the base of the distal phalange of the little finger. Now for all the fingers, like digits, on the phalangeal shaft there is a synovial sheath of the fingers are covered by fibrous sheath, okay, and next would be the canals of the anterior region of the hand. First is canalis carpi ulnaris. Now it forms fascia around the pisiform bone, okay. Now this canal contains ulnar artery and nerve and passes under the palmaris brevis muscle. Next is canalis carpalis. It forms fascia between flexor reticulum and bones of it forms between flexor reticulum and bones of scaphoid bone, trapezium, pisiform and hamate bone. Now this is this carpal tunnel, okay, canalis carpalis. It contains 4 flexor superficialis tendon. See, this tendon, it's passing here, fine. There are 2 separate synovial sheath for each flexor digitorum muscle. Tendon of the flexor digitorum superficialis and profunda muscle, and other one for tendon flexor pollicis longus. Now next is canalis carpi radialis, contains tendon of flexor carpi radialis muscle. Now next are muscles, intrinsic muscles of the hand and intrinsic muscles of the thumb. First is thenar muscles, which is lateral muscles of the which contains abductor pollicis brevis muscle, opponens pollicis, flexor pollicis brevis and adductor pollicis. First is abductor pollicis brevis, opponens pollicis, flexor pollicis brevis and adductor pollicis. Next is these are thenar. Next is hypothenar muscles. Hypothenar muscles are abductor digiti minimi, opponens digiti minimi, flexor digiti minimi brevis and palmaris brevis muscle. These are hypothenar thenar muscles. Next is median muscle group, which is lumbricals, palmaris, interosseous, first dorsal, interosseous. These are medial muscle group. Now we move on to the next topic, which is topography of the dorsal region of the hand. Now layers. First is skin, which is thin. Hair follicles are present. Sweat glands and sebaceous glands is there. Furnicles tends to occur in this region. Nerve is radial ulnar and median nerve. Subcutaneous tissue contains loose connective tissue and phlegmons. Cephalic and basilic vein is there. Radial nerve and ulnar nerve. Radial is superficial branch, ulnar is dorsal branch. Next is superficial fascia, which is fixed to the styloid process and bones of the wrist. Deep fascia forms extensor reticulum, forms 6 canals with carpal bone, which is medial to lateral. First one, tendon of extensor carpi radialis, then tendon of extensor digiti minimi, tendon of extensor digitorium and extensor indicis muscle. Next is tendon of extensor pollicis longus muscle, tendon of extensor carpi radialis brevis and extensor carpi radialis longus muscle, and next is tendon of extensor pollicis brevis and abductor pollicis longus muscle. Next is tendons of extensors, where median, medial and lateral. Median, there is middle phalanges, medial and lateral distal phalanges. Now the patient suffering from ulnar nerve palsy, what is damage? The extension of the proximal phalanges may occur and flexion of the distal and middle phalanges may occur. Topography of the wrist. There are two compartments, anterior and posterior compartment. In the anterior compartment of the wrist, the landmark, the structure passing superficial to the flexor reticulum. Now this from medial to lateral, what are present? Superficial to flexor reticulum, there is flexor carpi ulnaris tendon. Okay. Next is ulnar nerve, which is palmar branch. Next is ulnar artery. Okay. And third is palmar cutaneous branch of ulnar nerve. See, ulnar nerve, ulnar artery, palmar cutaneous branch of ulnar nerve. And next is palmaris longus tendon, palmaris longus tendon, palmaris cutaneous branch of the median nerve, palmaris cutaneous branch of the median nerve. Now next is deep to flexor reticulum. There are flexor digitorium superficialis tendon, okay, median nerve, and flexor pollicis longus tendon. Okay, flexor pollicis longus tendon, flexor carpi radialis tendon. Now median due. Median due, it is flexor pollicis longus tendon and median nerve. Flexor pollicis longus tendon and median nerve. Radial trio. Radial trio is radial artery, flexor carpal radialis tendon, flexor pollicis longus tendon and sheath of radial bursa. Flexor radial trio is radial artery, flexor carpi radialis tendon, flexor pollicis longus tendon and sheath of radial bursa. Okay. Ulnar trio is ulnar artery, ulnar nerve, flexor carpi ulnaris tendon. And tendon quartets is flexor digitorium superficialis and profundus tendon. Now this was anteriorly. What is posteriorly? Posterior compartment of the wrist, the structures passing superficial of the extensor reticulum. Posteriorly there is extensor reticulum. So superficially from medial to lateral. Ulnar nerve, basalic vein, cephalic vein, radial nerve, superficial branch. Now passing beneath the extensor reticulum. Passing beneath the extensor reticulum is tendon of extensor carpi ulnaris, tendon of extensor carpi ulnaris, tendon of extensor digiti minimi, tendon of extensor digitorium, tendon of extensor indicis, extensor pollicis longus, tendon of extensor carpi radialis and extensor carpi radialis brevis, and tendon of extensor pollicis longus and extensor pollicis brevis muscle. Okay, now we move on to the topography of fingers. Now in fingers, the soft tissue are thin and muscles are absent. Only tendons of the muscles are present in the fingers. Now layers, skin thick in the palmar where sweat gland is present, and thin in the dorsal, hair follicles, sebaceous glands, sweat glands are present. Subcutaneous tissue, thin and surrounds the tendinous sheath of flexor digitorum profundus and flexor digitorum superficialis muscle. Now this tendinous sheath is index, middle and ring finger, where head of the metacarpal, thumb and little finger, continuation of palm and forms ulnar and radial bursa. On the dorsal surface there is no sheath. Superficial fascia is almost absent. Deep fascia, phalangeal shaft, then synovial sheath of the fingers covered by dense annular fibrous sheath. In the phalangeal joint there is phalangeal shaft and cruciform fibrous sheath. Now the grooves, canals and fatty tissue of this region. In the forearm there is sulcus radialis, sulcus ulnaris, sulcus medianus. In sulcus radialis it lies between brachioradialis laterally and flexor carpi radialis muscle medially, and there is superficial branch of radial artery, nerve and vein. Sulcus ulnaris, it is between flexor carpi ulnaris muscle and flexor digitorum superficialis muscle laterally. It contains ulnar artery, vein and nerve. Sulcus medianus, it is between flexor carpi radialis lateralis, means laterally, and flexor digitorum superficialis muscle medially. It contains median nerve. In wrist and hand there is canalis carpi ulnaris, which contains ulnar artery, vein and nerve. Canalis carpi radialis, it contains tendon of flexor carpi radialis, superficial branch of the radial nerve and palmar branch of radial artery. Now arterial network of the elbow joint. It forms branches of the brachial, radial and ulnar arteries, and it supplies the ligament and bones of this joint. Now there is lateral epicondyle of the humerus and medial epicondyle of the humerus. In the lateral epicondyle, anterior and posterior. Anterior part, there is radial recurrent artery, which is branch of radial artery, and radial collateral artery. Okay, radial collateral artery, which is branch of deep artery of the arm. Posteriorly there is middle collateral artery and recurrent interosseous artery. Medial epicondyle, anteriorly there is anterior ulnar recurrent artery and inferior ulnar collateral artery, and posteriorly there is superior ulnar collateral artery and posterior ulnar recurrent artery. Olecranon fossa. Olecranon fossa, just superior to it there is inferior ulnar collateral artery, middle collateral artery and posterior ulnar recurrent artery. Now operations for phlegmons of the fingers. If we have tendinosynovitis, inflammation of a tendon of a sheath, phelon vitello, inflammation of the fingers, paronychia, infection of the skin fold at the margin of the nails. Now we need to perform an incision where lateral side of the fingers near the palmar surface between the joints. If there is a phlegmon in the palmar region, incision must be border of the thenar and hypothenar muscles. It is dangerous in the proximal 1/3 of the thenar due to the branch of the median nerve. Now next is the spaces of the forearm. First is the Paron-Pirgov space. It is a quadrangular space above the wrist located between third and fourth layer of the muscle, where third layer is flexor digitorum profundus, flexor pollicis longus, and fourth layer is pronator quadratus muscle. Proximal pair, it connect to the oblique origin to the flexor digitorum superficialis muscle, and distal part flexor reticulum and mid palmar and thenar space. Spaces of hand is between fascia and septa of the fascia. They are divided into palmar and dorsal region spaces. Palmar spaces, hypothenar space of the fingers, mid palmar space and thenar space. And next dorsal space, there is dorsal subcutaneous space deep to the loose skin. Dorsal subepineuritic subtendinous space, which is between metacarpal bone and extensor tendon. Now mid palmar space is a triangular space. Proximal part is connected to the distal margin of the flexor reticulum, which communicates with the forearm space, and distally there is third and fourth lumbricals. Border is anterior palmar epineurosis, posteriorly third, fourth and fifth metacarpal bone, third and fourth interosseous space, and head of adductor pollicis muscle. Medially, medial palmar septum, and laterally intermediate or oblique palmar septum. Now contents are flexor, tendons of the third, fourth and fifth finger, superficial palmar arc, digital nerve and vein of the medial 3.5 fingers. Second, third and fourth lumbrical muscles. Now next is thenar space. Thenar space is a triangular space, outer 1/3 of the hollow of palm. Proximal part is connected to the distal margin of the flexor reticulum, and distal part is connected to proximal transverse palmar crease. Border is anteriorly tendon of flexor digitorum, flexor digitorum superficialis, which is covered by ulnar bursa. Anteriorly is short muscles of the thumb, flexor tendon of the index finger and first lumbrical muscles, and palmar aponeurosis. Posteriorly is fascia covering the head of adductor pollicis and first interosseous muscle. Medially intermediate palmar septum, and laterally tendon of flexor pollicis longus muscle with radial bursa and lateral palmar septum. Content is tendon of flexor pollicis longus muscle with synovial sheath, flexor tendon of the index finger, first lumbrical muscle, and palmar digital vein and nerve of the thumb and lateral side of the index finger. Now topography of the shoulder joint. Shoulder joint projection: anteriorly coracoid of process of scapula, posteriorly inferior to acromion, laterally line between the acromial end of the clavicle and coracoid process of the scapula. Types of joint are diarthrosis, which is also called as true interrupted cavitated synovial movable joint. Ball and socket joint, multiaxial simple joint. Bones involved are spherical head of the humerus, glenoid cavity of the scapula. Articular capsule from labrum glenoidal of scapula to anatomical neck of the humerus. The greater and lesser tubercle is also situated inside and extends till the surgical neck of the humerus. The content surrounding the capsule: anteriorly subscapularis, coracobrachialis and short head of the bicep brachii muscle. Posteriorly supraspinatus, infraspinatus and teres minor muscle. Laterally deltoid muscle and tendon of long head and bicep brachii muscle. Inferiorly axillary recess and capsule consist of two layers, fibrous and synovial. Now what are the ligaments? Coracohumeral ligament, which is from coracoid process of the scapula to the greater tubercle of the humerus. Glenohumeral ligament, superiorly apex of the glenoid cavity, small depression above the lesser tubercle. Middle margin of the glenoid cavity, lower part of the lesser tubercle. Inferiorly, inferior margin of the glenoid cavity to inferior part of the anatomical neck of the humerus. Transverse ligament of the humeral ligament, upper part of the bicipital groove. It converts intertubercle groove into a canal. Stability of the joint, coracoacromial arc, where acromial ligament and coracoid process is there. Musculocutaneous cuff or rotator cuff muscle tendon. Supraspinatus, infraspinatus, teres minor and subscapularis muscle is present. Labrum glenoidally encircles margin of the glenoid cavity, long head of the bicep and tricep brachii muscle, and also the atmospheric pressure is important. What are the movements? Movement is flexion and extension around the frontal axis, abduction, adduction around the sagittal axis, supination and pronation, vertical axis, and circumduction. Now next is bursa. There are different kind of bursa. First is subscapularis. Subscapularis bursa. It is lodged between tendon of subscapularis muscle and scapular neck. Okay. It protects the subscapular tendon and connects with the shoulder joint cavity. Subdeltoid. Subdeltoid bursa is between deltoid, supraspinatus muscle and fibrous capsule. Okay. Subacromial. Subacromial bursa. It is found inferior to the acromion and coracoid process and between supraspinatus muscle. It facilitates the movement of the supraspinatus muscle, and infraspinatus bursa communicates with the joint cavity. Now, if inflammation from axillary recess to the axillary cavity, subscapular bursa to subscapular osteofibrous space, vagina synovialis intertubercularis to subdeltoid space. Arterial supply is anterior and posterior circumflex humeral artery and thoracoacromial artery. Venous drainage, anterior and posterior circumflex vein, circumflex humeral vein and thoracoacromial vein. Lymphatic drainage, supraclavicular node and axillary node. Nerve supply is axillary nerve and suprascapular nerve. Now next is topography of the elbow joint. It consists humero-ulnar joint, humero-radialis joint and radio-ulnaris joint proximally. Projection is 1 cm distal, lateral epicondyle, 2 cm distal, medial epicondyle of humerus. Types of joint: diarthrosis, synovial, cavitated, true movable interrupted joint, hinge joint, humero-ulnar joint, pivot joint, proximal radio-ulnar joint, ball and socket joint, humero-radial joint, trochoid joint, combined joint, proximal radio-ulnar joint, and compound joint. Bones involved are capitulum, trochlear notch, head of radius. Okay. articular capsule attached to the humerus at the margin of lateral and medial epicondyle end or lateral and medial end of articular surface of the capitulum and trochlea. It is weak at the anterior and posterior side but strong at the side due to collateral ligament. Now there is recus sacciformis, which is neck of the radius, and inflammation of the elbow joint spread to the deep spaces of the forearm. Now contents surrounding the capsule is anteriorly brachialis muscle, posteriorly tricep brachii muscle, laterally radial nerve, spinator muscle, anconeus, postomedially ulnar nerve. Movement is flexion extension frontal axis. Now ligaments are radial collateral ligament, ulnar collateral ligament, annular ligament of radius. Okay. Now bursa, olecranon bursa between olecranon and tricep brachii tendon. Subtendinous olecranon bursa, subtendinous olecranon bursa, subcutaneous connective tissue over olecranon, and intertendinous bursa in tendon of tricep brachii muscle. Radio-ulnar bursa between extensor digitorum muscle, humeral radial joint, and supinator muscle. Bicipitoradialis or bicipital bursa between bicep tendon and anterior part of radial tuberosity. Artery supply and venous drainage, brachial artery and vein, radial artery and vein, ulnar artery and vein, and lymphatic is deep cubital node, axillary node, nerve is ulnar and radial median nerve. Okay. Topography of the wrist joint. Now type of joint is diarthrosis, interrupted synovial true cavitated movable joint, complex joint, ellipsoid joint, which is 2 axis, biaxial joint. Bones involved are inferior concave surface of radius, discus articularis of ulna, proximal row of carpal bone, which is scaphoid, lunatum, triquetrum. Okay. Articular capsule attached to the styloid process of radius and ulna and proximal lobe of carpal bone. Synovial membrane line the fibrous capsule. Protrusion of this is pre-styloid recess. Front of the styloid process of ulnar and articular disc, which is strengthened by collateral palmar and dorsal ligament. If there is recus sacciformis between radius and ulna formed by synovial membrane of articulation radio-ulnaris distalis. Now pronator quadratus muscle is situated anteriorly, tendon of extensor muscle, which is dorsal part of the wrist, tendon form carpal canal, which is palmar surface. Now ligament is collateral ligament. Okay, first is radial collateral ligament. It is from tip of the styloid process to lateral side of the scaphoid. It does adduction. Ulnar collateral ligament does abduction, and it is from tip of the styloid process to the ulna of the triquetrum. Next is palmaris ligament. Palmaris ligament, there is palmar radiocarpal ligament, palmar ulnocarpal ligament. Palmar radiocarpal ligament, it stretches from radius to the scaphoid bone. This stretches from radius to the scaphoid lunatum and triquetrum. Palmar ulnocarpal ligament, it stretches from ulna to lunate and triquetrum. Now there are some dorsal ligament. Which are those? Which is dorsal radiocarpal ligament and dorso-radio-ulnar ligament. Okay. Next is movement, flexion and extension, adduction, abduction, circumduction. Artery, palmar carpal, arches, which is superficial and deep. Venous is palmar carpal arches, and nerve supplies anterior and posterior interosseous nerve. Now until this, the anterior, the upper arm, only last part is remaining, which is the surgery. Henceforth, next video I would upload the surgeries, and the upper arm, upper extremities is done. So keep watching, keep learning. Thank you.